So today we are going to discuss statics form for incident report. Whenever there is SPT, you can say raising the concern, raising the issue, or filing the incident report. But whenever there is SD, always say statics form for incident report. Definition. What is definition? Definition is incident reporting is the process of capturing, recording and managing an incident occurrence for clinical, environmental, professional or services issues. Purpose of Datix form to state the cause of problem along with corrective action to minimize the risk of future recurrence by reporting an incident creating an official record of event. Details can be recalled or referred in future. Analysis of incident enables us to learn from event and developing and improving services and identifying training needs. Or in simpler form, we can say if anything went wrong with the care of patient, minimize the possibilities of recurrence similar event, make a recommendation for delivery of health services in the future. What is the duration? It's important to report at earliest, ideally within 24 hours, when everything's fresh in mind and further details can be added later on. Team. Team who takes care of incident reporting once it is reported by someone. So who reports? He is the incident reporter. Now who takes care of the incident reporting once it is reported? First is the incident manager. Second is the clinical team leader. Clinical team leader, professional leads. Care team is practically not involved in the investigating team. This we are talking about the after the stage one, that is statics form one. Once we fill that, then who is going to take care of this? So it is incident manager, clinical team leader, professional lead, independent investigation carried separately from any police, legal, or coroner's proceedings. It depends upon which kind of incident is level 1, level 2, level 3, or level 4, level 5. It is done by an independent expert organization which is given access to all information, all informations and reports about the individual patient's care and treatment within the usual patient confidentiality rules. That is very important. So we always address by patient X, and if for the care team we'll address like staff A or staff B this way within the usual patient confidentiality rules, and who can interview the NHS staff involved in the care and who witnessed the incident. So this is the team. So basically, this is the team who investigate the in any Datix form or incident report. Next is Datix form. Datix form, there are of two types. Datix form 1 for reporting the incident within 24 hours. So this is by the who is involved in the incident. The main person who is involved in the incident who is going to report it within 24 hours, right? Datix form 2, that is the reviewing the incident. Once it is once it is reported, then the this is reviewed by the some manager. So this is that is form 2 is the reviewing the incident. That is the manager informed to log the investigation in 48 hours. So what Datix form 2 basically does, so Datix form 2, which is done by the incident manager, that is what is the actual impact of the incident, what is the category of the incidents, what it is diagnosis of the incident, all care provided, risk identified, and how are they managed. Update the action taken, any immediate learning, and considering the duty of condor, that is all decided in the Datix form 2. What is patient safety incident? By chance, if your junior asks, what is patient safety incident, then you should know any unintended or unexpected incident which could have or did lead to harm for one or more patient receiving NHS care. Because these are the question your junior who has come to you to understand how to fill a Datix form, because he has something has been done under his care. So now he has been asked by his educational supervisor to file an incident report, because it is like basic rule, even if patient doesn't ask for this, you are supposed to do that. What is national reporting and learning system? This was introduced by the National Patient Safety Agency. The system enables the patient safety incident report to be submitted to a national database. The data is then analyzed to identify hazards, risks, opportunities to improve the safety of patient care. Basically, you have to learn these two definitions because your junior may ask. Now, how to report? Many community trust computers will already have a Datix icon on the desktop to access the Datix incident form. Even you do not need to log in or password. This is so very important there in UK. If you haven't got the Datix icon on your computer, you can add it to by typing the following address. You're not supposed to learn this much, but you should know this much. If your junior asks, how can I do this reporting? So you can say that there is an icon. If you do not get any icon, then you can log in through this ID. Now, understanding the more about an system like our incident reporting system at CNWL. So, what all you are supposed to take care whenever you are filling an incident form? What are the principle of filling? Anonymizing your description. This is very basic in all the NHS. Whenever we share the data of patient, that you have to anonymize the data because you cannot declare patient name and etc. So no names of the patients or staff, but you can use patient or staff initials or phrasing like patient A or staff X, something like that. Avoid abbreviation or jargons. This is something very important. Third, unsure about spelling. If you are not sure about spelling, please correct it. This is very important because this is for future reference as well. Was anyone else involved in this incident? It is important to log the details of anyone else involved in the incident. If say someone, see if I am filing a incident report or I'm filling a Datix form, I have to mention the name if anybody else is also informed. If there were other patient or staff involved or witness an accident, you have to mention the name. It's not about you only. What happens after I log in an incident in the Datix? Directly after, if you have logged an incident on Datix, a range of staff are notified of the incident, but also go to the member of the central safety team, governance team, and the other managers and director. This much you have to. Everyone mute yourself. Datix does not just record incidents. So this is something very important because it holds the information of the incident, feedback, claims, requests. So it is, do not take it as just for the sake of recording any incident you are recording. If you enter a complaint on the incident form, it will not link to the feedback part of the system. Therefore, you may need to enter it all over again. What does it mean? It means that feedback is not given in Datix form 1. That is given in Datix form 2. Now the categorization and the subcategory is very important to pull together the incident of same type. I'll just let you know what does it mean. Now the severity. This relates to the actual harm at the time of the incident. Actual harm. This is how potentially bad the outcome could have been, but what actually occurred. So this is the severity. Now definitions are as follows. So the categories, as I have told you earlier, so there are 5 categories of the severity. No harm. Any incident that had potential to cause harm but was prevented, resulting in no harm. Okay. Low, any incident that required extra observation or minor treatment caused minimal harm. Third is the moderate, that is level 3. Any incident that resulted in moderate increase in the treatment and which caused significant but not permanent harm. Then the severe and the death. This comes under severe category. So we can divide in three part as well. These two are mild, this is moderate, and these two are in severe. So you can find it anyways in different NHS. Somewhere they have mentioned it as mild, moderate, severe, and somewhere they have mentioned in five levels. Like this is level 1, this is level 2, this is level 3, this is level 4, this is level 5. Now I'll show you Datix form. This is Datix form. You just go through incident date, incident time, description, immediate action taken, notify. There is a probability if it is comes as teaching that you might find this kind of some form in your candidate instruction that you must you will be given some candidate instruction that Sam has come for this, and then maybe 3 4 pages. So do not get afraid of the pages. Just take a picture of this. This is simply DF1, Datix form 1. So these are the different part of Datix form. Okay. Details of the reporter, subtype, first name, surname, job title, telephone number, email, team, specialty, borrow, directorate, etc. Location. So these are the different subheadings where they can see identity, accident location. So these are the subheadings. Details of the person, these are the subheadings. So basically, few headings, incident classification heading, this is the subheading, right? This is the subheading. This is a subheading, this is subheading. I have given in the details so you can understand. What are the details of the form 1? So this is incident date, there is incident time, site and the location. If you just take the printout of these form, uh, these are the details which are given there, which you are supposed to teach your junior. So incident date, incident time, site, location, then the description, and then incident type, category, subcategory, classification, then actual harm to patient, actual impact on the organization. And these are the levels. Level 1, insignificant. Level 2, minor. Level 3, moderate. Level 4, major. Level 5, catastrophic. So this is severe, this is moderate, this is mild. Right, so this is taken care by, as you can see, it is like difficult to read, but you can individual performance review. So basically it is mainly individual performance review, sometime by the management or the risk management plan, and we provide care plan review. But these two, by the governance assurance report, this is also governance report. Assurance report, normally it takes 72 hours to investigate. Why? It's not to generate the report, it is to investigate. It is to investigate that whether the category which is mentioned is right or not, whether this particular task is a particular incident report is needing any kind of investigation or not. So this is how they decide in this much duration. So this is investigation required. Do not confuse it with this that they are going to give feedback or complete report in this duration. Okay. Everyone mute yourself. Then level 1, 1 and 2, it is normally managed by local manager or the individual person. This is minor, no harm, individual review. Level 3, which is moderate, 2 weeks is the deadline. In 2 weeks, they have to complete their report. Normally, any senior staff, clinical nurse, sometime a medical director can also do that. Okay. So this is moderate. Level 4, level 5, when it is severe and where there is death. So 60 days deadline, and the senior management team do the investigation. Now, section 4, the pupil involved. So person affected, alleged preparator, then the silent, other involved. So this is, so section 4, here you have to search section 4, where these are the details you are supposed to teach your junior. So I have mentioned every section. I've written every section separately. So it will be easy for you to understand what you are supposed to teach to a junior while filling these three forms. Now, section 5, in the name of the person, email address, then incident manager. The incident manager is the individual. This is important to understand. Incident manager is the individual who will need to approve the report and initiate further action. This normally takes 48 hours. Normally take 48 hours. Sometime it may take 72 hours, as we have just read in severe and the death, right? That is level 4 and level 5. So incident manager is basically who deals with the uh, DF2. So here he is going to mention that who is going to be my incident manager, right? So because the incident manager will automatically receive the mail in that case, who will need to improve the report, initiate the further action. This is usually the person who is in charge of the team subject to the incident, such as the team who manages the patient care. But whoever has the care team who has committed that particular negligence is cannot be in the team, because in one hospital there can be 3 4 obstetric unit, there can be 3 4 gynae unit. So the incident has happened particularly say under team A, under obstetric unit A. So obstetric unit A is not going to be the part of that investigating team, right? So team who manages the patient care, and sometimes we need to take the external support when there is some environmental issue. Immediate action following the incident. Once the incident form is completed, it should be submitted by pressing the submit tab at the bottom of the page. Once submitted, the report will be generate an email which will be sent direct to the Datix system to the reporter, that is incident manager, team leader of the team under which the incident has been reported, because probably I am one of the part of the team and I have reported. So everybody who was involved in the care team will get that, and the any special team identified by the category of the incident selected, means the team who can probably investigate, or who a team like, see, if there is one medical director of obstetric unit and there are 4 subunits, so probably medical director is going to be that specialist team who should be informed. They can access the report, check for the accuracy, immediate action. The incident manager has 3 working days. Somewhere it is given 48 hours, somewhere it is given 3 working days. So you can say 48 to 72 hours as per different NHS trust. Because somewhere it is given 48 hours, somewhere it is given 3 days to review and action the incident report. Review and action. If it is individual, harmless, like no harm, then probably in 3 days they will give some feedback in report. But when further investigation is required, definitely when there is moderate, when there is severe, when there is death, further investigation would be needing. It is not possible to perform that in 3 days. So first 48 hours to 72 hours, incident manager will go through the incident report, will categorize, will confirm that everything is fine. If it is low harm, or if it is no harm or low, probably an individual review and the just closing the incident report and giving the feedback. But if it is something like moderate, severe, or anything more like grave in the severity, in that case further investigation may be required. And time scale for the managing the incident will be determined by the type of investigation being completed. So time scale is different for different kind of incident. During this time, incident will be marked as under review by incident manager, right? Once it is going through investigation, under review, once the incident has been managed and the appropriate action is taken, then incident manager will mark as resolved. Okay, I think that's it, because there was not much to talk about. There was one more slide I think I missed. No, I have mentioned a 60 days deadline. That's it. Nothing else. I'll just upload this in YouTube very soon. So you can go through, because this can come as teaching station that your junior has come because he understand how to file a Datix form, how to fill a Datix form because he has to file an incident reporting because something has happened and now he has come to you. So in that case, first there will be introduction. After that, first you will rule out the bullying. Then third, setting the agenda that why he has come here, what did bring him today. So in that case, first you will listen to him, then you will assure that whatever is concerned, you are going to address everything one by one. After that, the first question is going to be, can you tell me the sequence of events? So then he'll inform you what has happened. So he'll inform this happened, this happened, this happened, this happened. Then patient is the concerned patient was unhappy. So my educational supervisor asked me to raise the incident reporting. In that case, if he says that he did not do something like this himself, then say it's our duty to perform duty of condor. If something has happened wrong, under our supervision, under our care, it's our duty to accept honestly what have done we have done wrong and what we could have done better. Okay, so what are the areas to improve? So this is duty of condor. This also comes with Datix form. I've gone through a lot today. Datix form. Datix, unfortunately, duty of condor is not something which is separated from Datix form. That is the part of Datix form. Duty of condor is a part of Datix form. So if your student says that because my supervisor has asked me to do that, that's why I'm doing, then you have to teach him that duty of condor is a very important part of Datix form. Even otherwise, practicing in NHS UK or even worldwide, we should follow this. That honestly, we should admit that what we have done wrong or where we can improve. So I think that's all for today, girls. Thanks for joining, and I'm uploading it. So I think that's all. Then after that, definitely, yeah. One more thing. Whenever your junior comes with the Datix form, so you will take the sequence of the event. You will understand that. You will teach him about the YouTube fund then and there. After that, first you will teach whatever he has done wrong. If he has missed some diagnosis or whatever, if he has done something like that, then first you will teach him that if you have missed the ectopic pregnancy diagnosis, how we do that, right? So you have to teach him the topic as well. It's not about same as we do in the reflective practice, right? We teach them, okay, cord prolapse management should be done this way. The same way you will teach that. Everyone, please mute hardly for some time. It is hardly for 10 minutes. Okay. So as we do in the reflective practice, we teach about the topic. Okay, cord prolapse should be managed this way. Ectopic pregnancy we diagnose this way. Same way, whatever incidents has happened, you will discuss about that particular incident as well. That what he has done good and where he has missed. After that, then you will take this form, like, okay, this is the Datix form. Then you will take, okay, this is as you normally give some idea. First, you will ask what you all know about Datix form, what this incident report, whatever he says, appreciate that. Then, what is the definition? Why we need this Datix form? That is the purpose. Then, what team is involved? What is DF1? What is DF2? Right? And what is the duration? What are the levels? And meanwhile, you just go through the Datix form and teach him and simultaneously ask him to fill it. Okay, we can fill it this way, we can fill it this way. So because they are like now UK or colleges like quite, I would say evolving in giving tasks. So reflective practice is quite common. Probably they may give Datix form filling as well. So just go through it once. I'll upload by night by tonight. I'm a little bit sleepy, girls. I'm sorry if I'm not very energetic. I'm very tired today. So that's all for today. Thanks for joining. Thank you very much. Goodbye.
Thank you, ma'am. Bye. Good night.
Good night.